topic that I'm going to be discussing is immune targeting of ovarian cancer. This is a very interesting, a very provocative, and to date quite challenging area. There's really quite sound scientific reason to believe that immune targeting of ovarian cancer makes sense. There are a tremendous number of preclinical data points looking at infiltration of various lymphocyte subtypes into ovarian cancer. Cells that suggest that there is both an immuno-augmentative effect and also immunosuppressive effect, and the idea that one could somehow modify that with a variety of manipulations, whether it's vaccines or immunostimulation, or today the most exciting areas in checkpoint inhibitors. It makes a lot of sense. However, trials to date have, quite frankly, been disappointing. Vaccine approaches have not shown to have an impact in the illness, although one can definitely show an immune response. You can measure immune response, but a therapeutic effect has not been seen. And in the area of checkpoint inhibitors, there's a lot of interest. There are several drugs that have been reported either in the peer-reviewed literature or mostly still in abstract form, have shown that there's a response. There are actually some short-term responses, but the percentage of patients that exhibit true objective responses, a major shrinkage of tumor or disappearance of tumor on the basis of imaging, the percentage is low, somewhere between 10 and 15 and maximum of 20%, which is the same story that we see with multiple cytotoxics that have been examined over the last 2 to 3 decades. So where we go from here is uncertain. Obviously, there's interest in a variety of approaches. One, of course, is combination therapies. But in my mind, the giant in the room, I'll use that term because it's so critical, is coming up with validated, clinically reasonable, actionable biomarkers. Clearly, there's a signal here. And again, each of these studies have shown patients who have had major responses. Now, when I say major responses, I'm talking about not just shrinkage of tumors, but no evidence of the progression of the disease for a year, 18 months, even 2 years. So how do we find out who those patients are? Is it the presence of particular neoantigens? Is it, there's a lot of interest in tumor burden, molecular, the mutation tumor burden. And perhaps that will be what we look for to find the patients whose cancers may respond, but today we simply don't know. So a lot of more research is indicated. Clearly this is an area that needs more research. Very excited about it, but we are just at a watch and wait stage in the management of ovarian cancer as it relates to immune targeting.